Our program will begin in 5 minutes. Thank you so much for joining us this afternoon for How Far Yet to Go? The Status of Women in Georgia, 1970 and Today. Please welcome Andrea Young, Executive Director of the ACLU of Georgia.
Good afternoon, everyone. Thank you so much for joining us today for a conversation about the status of women in Georgia. This conversation is meant to raise awareness, to call attention to the many ways the policies in the state of Georgia fail women. This was an experiment to see whether there is an interest to strategize on a policy agenda that has women's rights as a focus. The answer is a resounding yes. Over 55 organizations are sponsors of this event. Policy and advocacy groups, sororities and civic organizations, academic groups, all are represented. So clearly, there is an energy across our state for women's rights and true equality. When the Georgia legislature passed HB 481 in 2019 and effectively banned abortions, we joined with many of you to fight back. We commissioned this report originally intending to show the progress Georgia's women have made following the decision in Roe v. Wade that enables us to control our own bodies and reproduction. As Deidre and Ifeanyi conducted the literature review, Deidre called me to say, Georgia's women are really behind. So the report objectives changed to reflect the facts. Our goal with this report is to initiate a statewide conversation about the status of women, to assess how far we have to go now to achieve equality, and to propose strategies for achieving the goal of genuine equality for all women in Georgia. As you know, today's event was originally scheduled in March to observe Women's History Month, but had to be postponed when the COVID pandemic began. As COVID has revealed more about the shape of systemic racism, it has also hit women especially hard. Women are both exposed as frontline workers and suffering disproportionately from the economic harm of the pandemic. Even women fortunate enough to work from home often carry the burden of childcare and homeschooling. The pandemic exposed gaps in our healthcare system, inequality in our schools, the vulnerability of women to eviction, and the callousness of employers in our service industries. The response to the pandemic reinforced my belief that the abortion ban is a symptom of an even larger problem, that in our state, the needs of women are minimized, ignored, and dismissed. That can and must change. In November, women have an historic opportunity to reject some of the members of the Georgia legislature who led the passage of the abortion ban and increase the number of pro-choice women in the House. In fact, we are 2 seats away from creating a pro-choice firewall in the state's House of Representatives. While Georgia's current U.S. senators support the abortion ban and are complicit in the anti-choice and often unqualified judges Trump and McConnell are adding to the federal bench, there are 2 pro-choice men running for the U.S. Senate who would be a vote against any Supreme Court nominee who would overturn Roe v. Wade. We have a lot at stake in November. And this report reminds us just how much is at stake. And so now I'd like to introduce the authors of the report, How Far Yet to Go? The Status of Women in Georgia, 1970 and Today. Ifeanyi Ukpabi is a PhD candidate at Georgia State University. His primary research explores the consequences of race, gender, class, and social inequality on Black people across socioeconomic statuses in the post affirmative action era. Deidre Oakley is the editor in chief of City and Community, the country's flagship peer reviewed journal of urban sociology, and a full professor of sociology at Georgia State University. Dr. Oakley's research focuses on how urban social disadvantages are often compounded by various local, state, and federal policies. Thank you both for this important work and welcome.
As Andrea just shared, the purpose of this report is to present an overview of meaningful indicators of Georgia's women's equality and well-being in health, education, income and employment, and political influence for 1970 pre-Roe and today. Before we provide a summary of our report, we must acknowledge the COVID public health crisis affecting our nation. Despite early reports as a shared social experience, COVID-19 has revealed and exacerbated the systemic racism that fundamentally structures our country. The historic legacy of systemic racism has produced unequal healthcare and working conditions that put Black and Brown people at a much greater risk of contracting and dying of COVID-19. Our current climate makes clear that we cannot have a full conversation about reproductive health and justice without acknowledging the inequalities caused by systemic racism.
We're going to share highlights since we understand there is only so much content we can handle on Zoom. We eager for folks to read the report and send us comments, questions, etc. in the coming weeks or months. Aspirations to reproductive justice began with 1973 Roe v. Wade decision and was further codified by the 1992 Casey decision. These decisions have given women the constitutional right to have an abortion, as well as privacy, autonomy, and liberty. Implicit in both decisions is that women's rights to choose when if to have a family is consistent with the constitutional liberty doctrine established by the 14th Amendment. Reproductive justice refers to access to family planning, safe abortion and contraception, pre-postnatal care, work with flexibility, maternal family leave, and affordable child care for all women. We share this aspiration for true reproductive justice, particularly because it will address the public health crisis of systemic racism.
We'd like to underscore that the overall results of our research suggest that Georgia's current draconian abortion ban law is a symptom of a much larger problem. Lawmakers have failed Georgia's women by nearly every measure of women's equality and well-being for the past 5 decades. But let's begin with some positive indicators. Georgia's GDP has been growing steadily since 1970 and now represents the 9th largest in the country. Women have played a vital role in this growth. In fact, today more women in the state complete bachelor's degrees or higher than Georgia's men. Today, about 41% of businesses are owned by women, ranking Georgia second in the nation. And Black women now have the highest labor force participation rate at 63.6%, with over 1/3 of Georgia's Black women owning their own business. For the first time ever, 3 of the nation's top medical associations are led by female physicians from Georgia. Dr. Patrice Harris, president of the American Medical Association, is the first Black woman to hold that position. In 1977, only 4.7% of our state legislature were women. By 2019, 30.5% were women, more than any other state in the South.
It is important to note that this progress was bolstered by the pioneering efforts of girls and women during the 1950s through the early 1970s. For example, Black girls and young women were the pioneers of school and higher education desegregation. In 1968, Atlanta domestic worker Dorothy Bolden co-founded the National Domestic Workers Union of America, ultimately leading to better pay for the sector, but also bringing visibility to an often invisible female labor force. Because of a now lawsuit and new federal laws, women in medical schools increased dramatically between 1970 through 1975. And in 1975, Morehouse School of Medicine was founded.
That same year, 1970, Georgia passed a law for access to safe hospital abortions. While the passage of the law saw an 80% decrease in white abortion mortality, Black abortion mortality only decreased by 33%, leading medical professionals at the time to call this Black abortion mortality issue a Black health problem. At the time, Georgia had the highest U.S. maternal mortality rate at 177 per 10,000 births.
Today, Georgia continues to lag well behind other states when it comes to women's reproductive health. Georgia continues to have one of the highest U.S. maternal mortality rates at 40 per 100,000, or 62.1 for Black women. And of the 159 counties in the state, 70 are now without OBGYN care. The health insurance coverage rate for women in Georgia ranks at a dismal 48th in the nation. In addition, while 11 states now have family and school leave provisions, Georgia has none beyond the unpaid Federal Family Medical Leave Act.
This is also the case when it comes to equality in the workforce. The pay gap between working men and women in Georgia persists, and it's even worse for women of color. Just to put this in perspective, if an employed woman in Georgia were paid the same as men, their poverty rate would be reduced by nearly half. And poverty among employed single mothers would drop by nearly 2/5. In education, we see inequalities as well. Black and Latinx women are less likely to receive an associate's or higher degree than white women, particularly outside the metro Atlanta area. Additionally, despite Georgia's GDP being ninth largest in the country, funding for K through 12 in the state is a major concern. Georgia has cut approximately $9 billion from public schools since 2003. Since 1970, families have become more diverse and smaller. Today, 34% of families with children are headed by single parents, more than doubling since 1970, the majority of whom are women. Despite these changes in family structures, state policies continue to view families as husband and wife with 2.5 children. An example of this is the dramatic cuts to temporary assistance for needy families, TANF. Since 2009, the Georgia General Assembly has cut available TANF funds by almost 30%. While the status of women in Georgia has certainly advanced since 1970, Georgia pales in comparison to many states and other regions in the country. Some of this lag has to be attributed to the South's history of regressive and segregationist policies. Yet a paradox emerges between opportunity and these disparities. Women, and particularly Black women, are driving business ownership in the state. The educational attainment of women exceeds that of its male counterparts. Workforce participation has risen, yet equality remains a distant goal. Women in Georgia are far from the promise of full equality or even reaping the benefits of increased participation in the workforce, political participation, and educational attainment. The following are initial recommendations, many gathered from our partners here today, to improve the status of women in Georgia. Number one, the Georgia legislature should ratify the Equal Rights Amendment Act, ERA, to the U.S. Constitution. The ERA will provide, for the first time, explicit constitutional recognition of the fundamental notion of gender equality. Number two, repeal Georgia's HB 481 and other restrictions on access to abortion care. The reproductive rights of Georgia's women should be affirmed by the legislature and not rely on the courts for protection. Number 3, fully implement the Affordable Care Act with full funding for Medicaid expansion. Women are the majority of those on Medicaid. Family planning services, maternal health, post and prenatal care would be available to hundreds of thousands of more women in Georgia. Mandated paid family medical leave. That's number 4. Paid leave allows workers to take time off to address serious health and caregiving concerns without risking their lives or livelihoods. 5, produce an annual report on the status of women in Georgia. A comprehensive report would shine light on the status of women in Georgia and provide a common frame of reference for evidence-based policymaking to improve women's equality in Georgia.
We hope our report provides a critical perspective on the status of women in the state of Georgia and can contribute to the policy discussions that will have a positive ramification on the lives of women throughout the state.
Thank you all for listening to us, and especially thank you to Georgia's ACLU for providing us with such a rewarding and unique opportunity.
We're looking forward to learning more from our panelists who are on the front lines of fighting for women of Georgia.
Thank you so much, Professor Oakley and Ifeanyi, for this presentation and the research. My name is Jewel Howard. I am the Atlanta organizer for 9 to 5, Georgia's chapter. 9 to 5 is a national organization that has been for the economic security of women, especially women of color, for the past 45 years. 9 to 5 has worked to champion issues such as the Family Paid Leave Act, fair pay laws, and Ban the Box that reduces discriminations against people with criminal records. We're now going to hear from our panelists, all of whom are advocates for a range of women's rights issues. They will add to our understanding of the current status of women in Georgia and opportunities for change. Our first speakers, Dr. Subhashi Narasimhanan and Dr. Dabney Evans, will be speaking about the arguments, tactics, and evidence used by supporters of Georgia's abortion ban. But before we turn to them, we have 2 short videos produced by the ACLU of Georgia, part of a larger series, Stop the Bans, Physicians Speak Out. These videos, which can be found on the ACLU website, were produced right after the Georgia legislation passed one of the most restrictive abortion bans in the country, a law which is currently enjoined in the court. They amplify physicians' concerns about women's health if such a ban goes into effect.
I believe that a bill like this is going to more negatively impact women that look different from me. I have the privilege of having white skin. I have the privilege of having money and social supports and higher education. Not everyone in this country has that privilege.
Well, women of color and low-income women already experience barriers to acting on their reproductive autonomy and being able to experience true autonomy in all aspects of their lives, including their reproduction. And putting up more barriers is just going to make this worse.
Communities of color or lower socioeconomic status, a lot of patients don't have super convenient access to their doctor. So they may say, oh, I think I'm pregnant, and they'll call for an appointment and they'll say, great, we'll see you in 3 months. So that right there, they have no access to a doctor. They don't have any opportunity to have a conversation about their options. If it's safe to move forward with the pregnancy, they can have new developments. They may have not even been to a doctor for 5 years, between their last pregnancy and this one.
Abortion saves lives. I've seen it. I've taken care of women who are alive because they had an abortion. And to take that away, it's terrifying.
Help us stop the bans. Go to acluga.org/stoptheban.
Being able to end a pregnancy that would impact women's educational experiences, that would impact their ability to care for their existing children, that would impact their ability to escape an abusive relationship. Having the ability to make that decision is just critical to women's lives. And so working in a state where that was not possible would mean that I was not able to meet my patients' needs.
We're not being pro-life. We're not seeing the value in a woman's life and what she brings, again, to our society if we're not saying that she can make decisions that could possibly, keep her whole.
We know from history that abortion bans make health outcomes worse and that they actually decrease the safety for women in our country. And so I know that these will certainly affect our women's health negatively.
And I'm going to start seeing women who are in a health crisis, infected, bleeding, dying.
Help us stop the bans. Go to acluga.org/stopthebans.
I'd like to now introduce Dr. Nara Seaman, who is a postdoctoral fellow for the Center for Reproductive Health Research in the Southeast at Emory University. In 2019, she was awarded the Society for Family Planning Research Fund's Emerging Scholars and Family Planning Award. And Dr. Evans is an associate professor of global health in the Rowland School of Public Health at Emory University, focused on women's health and human rights. As an established trainer and teacher, she has touched over 19,000 learners from 171 countries. Welcome you both.
Thank you so much for that introduction, Jewel. Hi, everybody. I'm excited to be here this afternoon to talk to you all about mine and Dr. Evans' project focused specifically on Georgia's abortion ban, HB 481. So a little bit of background. Georgia's abortion ban was put forth in the legislature around March 2019, and it was championed by Ed Setzler along with 5 other representatives. Next slide. The study purpose really was that we wanted to understand the anti-abortion rhetoric used in the HB 481 legislative debate and community testimony. So legislative debate here, we're talking about what legislators said during discussion of the bill. And community testimony is what are the narratives that community members put forth in support of this bill. The impetus for this study really was frustration with looking at how abortion bans had proliferated across the United States. And we know, as discussed by all the previous panelists, that abortion bans have a negative effect on Georgia's most marginalized women. So we set forth as people who had been part of this democratic process to sort of document and systematically understand what were legislators saying in support of this bill. And this is what we found, which I think is to some people may be quite a shock and a frustration. We feel that the rhetoric put forth by legislators in support of HB 481 is really a form of reifying structural violence. And by that, I mean the increased marginalization through colorism, through racism, and within the legislative debate. And so how we divided these results up is we've said, okay, what were they saying? What were both the legislators and community members who were in support of this bill saying? And then how? So what is the tactic that they were using with this kind of rhetoric? And we found that the what was this focus on the idea of heartbeat. So as many of the people who have been following HB 481 know, that the pro-life term of choice is that this is a heartbeat bill. So the ban should be at the detection of a heartbeat, which sometimes is at 6 weeks, but could be earlier depending on if a physician deems that a heartbeat has been heard. This is not a biologically determined or a medically scientific or sound argument. So within the legislative debate, the legislators were pushing this heartbeat as a marker of life. The second and even more insidious what that we found was that they were they were putting forth an argument for creation of a new protected class of people. So using what we call equal protection arguments under the Constitution and saying that fetuses deserved the same equal protection as women of Georgia. And beyond that, we also saw that they wanted to expand the state sovereignty rights to protect fetal rights. So sometimes states expand laws beyond that of federal statutes in order to protect the people in their states. One really good example of this is California's emission laws. So California has higher standards of emission laws than the federal government requires. They believe that protects the environment of their state. Here, what legislators were discussing is that they needed to expand state sovereignty, so the rights of the states to decide beyond that of Roe v. Wade. And the states should also reclaim what is viability, and the new viability standard should be at heartbeat. The goal of this also, what in their rhetoric, was first to pass the legislation, which we know the legislation passed by an extremely slim margin, but was enjoined by the current challenge of Sister Song, the ACLU versus Kemp. And then finally, to move this up the court system to challenge Roe v. Wade. So now that I've given you a precursor to what people said, now I want to talk a little bit about the tactics. So the how. We saw that a lot of this rhetoric was used in purpose of something. So first, it was used in purpose of appropriation. So appropriating what we saw as progressive arguments, and I'm going to move us forward to Dr. Evans, who can cover some of the more deeply detailed portions of this results.
Thank you so much, Suba. If we can next move to the next slide, I do want to warn that what we're going to do here is share some direct quotes. And these data were gathered from the hearings that took place during the debate of HB 481. And so the text that you see in yellow print are some examples of some of the arguments that were made both by legislators and community members. So as Dr. Narasimhan said, this is a scaffolded argument that begins with the argument about heartbeat as being a measure of life and then personhood. And this is really the grounding and the footing upon which the entire argument about HB 481 sits, basically trying to define heartbeat as a marker of life. We'll move to the next slide and the next element. The second element in the arguments that were being made, principally by legislators, were to underscore the value and vulnerability of fetuses. And this was grounded in an argument that was highly offensive, particularly to those from the Black community, because this argument was grounded in the 14th Amendment. And for those that are familiar with this history, this was not the intent of the 14th Amendment, but the intent of that amendment was to ensure that classes of persons that had been discriminated against, in particular enslaved Africans, were given full legal recognition. And so what's happened here is that proponents of HB 481 are co-opting the 14th Amendment to advance this argument for an early abortion ban. Next slide. The third part of the argument is a states' rights argument. And basically, the argument here is that the federal government should not be legislating, and particularly the courts should not be making decisions, and that these decisions should be left to states to legislate over their own provisions and protections. The argument here is that states are attempting to create protections that are above and beyond federal protections in this thinking. Next slide. And what we've got here, it's very difficult to see, but we do have this paper available online. And what we did is we actually did some fact checking for each of these arguments and the particular data points that were given or the evidence that was given by legislators in making their arguments. And we've fact checked that against reliable evidence sources that are known to be reliable sources of information. Next slide. And so the biggest takeaway from all of this work has to do with appropriation. And so we see that what proponents of HB 481 and other early abortion bans are doing is they're actually taking some of our arguments, progressive arguments, and using them against advocates in order to advance early abortion ban legislation by attempting to create a new protected class of persons, which are fetuses in utero. We're really grateful to the ACLU of Georgia and Sister Song and the other plaintiffs that are advancing the case against HB 481 in the courts. And I'll be happy to talk about that later on. Thanks so much.
Thank you both so much for this insightful presentation. We'll now turn to Randy Gregory, Georgia State Director of Care in Action, an organization fighting for the dignity and fairness for the millions of domestic workers in the U.S., most of whom are women of color. She has been working on progressive issues for the past 9 years as an electoral, union, and issue-based organizer. She is a Gates Millennium Scholar and a proud member of Gamma Phi Delta Sorority Incorporated. Welcome, Randy.
Hi again. I was saying that I appreciate the shout out to Dorothy Bolden earlier, who founded the National Domestic Workers Union of America, and she's from here in Atlanta. And so we can, I assume y'all can see my slide. So we can go on to the next slide about the National Domestic Workers Alliance. So NDWA, we're one of the largest workers' rights organizations in America. We have over 60 affiliate organizations all around America. We started in 2007. We started with a staff of 8, and now we have, I believe, almost 90 folks on staff. We also have the NDWA Labs, where we work on technology that can help domestic workers, like ACLU, which is a program that we started to help give cash benefits to domestic workers. Because I'll talk a little bit later about why they would need things like that. But yeah, so NDWA is an organization that was built to help the most marginalized workers, domestic workers. And so we've been doing advocacy and organizing around that, like I said, for the past 13 years. And we can move forward to the next slide. And so Care in Action is the sister political organization to NDWA. And we can move on. We can move forward to the next slide. Okay, so Care in Action was founded by our executive director, Aijen. She's the executive director of NDWA. And so she founded Care in Action so that we could more be involved in a more explicitly political way, so that we could organize around specific legislative issues, and that so we could help support specifically women of color candidates. So we can move forward to the next slide. So who are domestic workers and caregivers? And we can move forward to the next slide. So every day, over 2.5 million nannies, housekeepers, and care workers do the work of caring and cleaning in our homes. And domestic workers are the nannies that take care of our children. The house cleaners bring order to our home. And the care workers ensure that our loved ones are able to stay at home and live independently in dignity. And most of these workers are majority women, mostly immigrant, and mostly women of color. And so we can move forward to the next slide. So when most of our country's labor laws, like the Fair Labor Standards Act, were drafted, domestic workers were deliberately left out. Workplace standards like a minimum wage, overtime pay, or protections against sexual harassment in the workplace are rarely extended to domestic workers, if at all. Many domestic workers do not earn a living wage and work without access to health care, paid sick days, or paid time off. And because domestic workers' unique workplaces inside other people's homes, the living wage and the struggles domestic workers faces are largely out of the public spotlight. Domestic workers take care of what is most important to us, yet they're often the least valued and the most vulnerable. And we can move forward to the next slide. So what does Care in Action do? So as I said, Care in Action right now, we have been running a huge voter registration program, a huge voter outreach program to women of color. We are working on endorsing women of color candidates and supporting them through donations, through giving them basically outreach for phone banking and canvassing. And so a lot of the times, when we are thinking about the candidates that we want to endorse, some of the issues that we like to focus on are reproductive justice issues, as everyone has been speaking about earlier. That's a very important part of NDWA and Care in Action's focus. And so we always ask candidates, what is their stance on reproductive justice? What is their stance on abortion, on affordable health care? And obviously, we want to know candidates' stance on care in general. We are for, as I said, child care, for elder care, for paid parental leave. And so we want to be able to make sure that we can support candidates that are going to support those issues that most affect women of color.
Thank you, Randy. And thank you for all your work in fighting for dignity for care workers. Now I am pleased to introduce Amber Mack, Research and Policy Analyst at Healthy Mothers, Healthy Babies Coalition of Georgia. This position is a front providing services and promoting policies to ensure all babies in our state receive the health and care they deserve. Welcome, Amber.
Thank you so much for having me. So happy to be here with you all today. And I will be speaking about the current maternal mortality crisis that the state of Georgia is facing. So let's go ahead and get into the facts. So I know that there has been a lot of conversation about whether Georgia as a state is the worst in maternal mortality, bottom 10. There's been a lot of debate about that. Regardless, we are facing a crisis. From 2012 to 2015, we saw 342 deaths of women that were either pregnant, delivering, or in the postpartum period out to a year. 42% of those deaths were related to pregnancy, whether that was direct or indirect. The rest were they happened to be pregnant and may have died of other causes like a car accident or homicide. I know a lot of times when we think of maternal mortality, we're thinking of women that die while they're pregnant or they die in the midst of giving birth. However, in Georgia, 80% of our deaths that are related to pregnancy occur in the postpartum period. Even more shocking is the fact that of all of our pregnancy-related deaths, 2 out of 3 deaths are preventable, which means most of those deaths should not have happened. And worst off, we see that among those deaths, and this is from 2012 to 2014, 60% of those pregnancy-related deaths were among Black women who experienced death at about a 3 times higher rate than white women. So now that we have this sobering picture, let's look into what we can do about this issue. So there have been efforts among advocates, legislators, and a host of organizations to address this crisis. Main one being extending the coverage of postpartum Medicaid to 12 months. Currently, it's at 60 days. We are a non-expansion state. So after 60 days of coverage, a lot of women are losing the care that they would need to prevent maternal death and improve their health. We do have a bill that is in progress, House Bill 1114, that's sponsored by Chairwoman Sharon Cooper, and happy to report that that passed out of the Senate Health and Human Services Committee yesterday. And so just keeping up with next steps with that. We also have the Maternal Mortality Study Committee that convened last fall that comprised of legislators and some obstetricians throughout the state, where they really got to talk about the facts. What's the problem? What are some of the solutions? And they came out with some recommendations based on that. And over the past 2 years, happy to report that the General Assembly has been great in terms of funding these initiatives. However, with the COVID-19 pandemic, a lot of these maternal mortality reduction initiatives were hit disproportionately and can have some long-term effects on our crisis. That includes the maternal mortality prevention hospital programs, which work to implement initiatives including neonatal abstinence syndrome, hemorrhage, and cardiomyopathy and hypertension, which are some of the leading causes of maternal death. That currently is facing a 75% cut. We also have the maternal mental health program, which would help providers screen, treat, and refer women to appropriate services when they're experiencing mental health crises, postpartum, or while they're pregnant. That originally was facing a 100% cut, but I'm happy to report as of yesterday, those funds have been retained. So as of now, it is fully funded, of course, still continuing to fight and watch out for that. We also, as was mentioned, have some disparities in terms of what places get care. So we have about half of our counties that do not have obstetricians, and that specifically affects rural communities. So there were 3 rural perinatal satellites that were proposed to be done throughout the state, and currently that is facing a 100% cut. And lastly, Morehouse School of Medicine has proposed a center of excellence to study our maternal mortality crisis and what some of the contributing factors are to that, as well as engaging the community. But because of proposed cuts to their general operating grant in response to the crisis, or the pandemic, I should say, that center is up for a potential cut as well. So, we know what the problem is. We know what we can do to address it. The legislature has been responsive in addressing those issues and funding those initiatives, but right now it's really a matter of retaining the funds.
Thank you, Amber. And last but certainly not least, let's welcome Jennifer Owens, Senior Vice President of Georgia Budget and Policy Institute. Jennifer's experience includes 14 years of Georgia-based public policy advocacy and community outreach, stakeholder engagement, strategic communications, and fundraising. Welcome, Jennifer.
Thank you. Thank you, Jewel. And I want to take this opportunity to recognize you, Jewel, for the work that you and 9 to 5 do to organize and advance priorities for women, both in Atlanta, but also across our state. Good afternoon, everyone. I'm Jennifer Owens, and our mission at the Georgia Budget and Policy Institute is to advance lasting solutions that expand economic and opportunity and well-being for all Georgians. We do this work by publishing upwards of 100 research products a year, strategic communications to get our research and our solutions in the hands of advocates, lawmakers, and the media. And we run a robust outreach and education effort in which we work with over 100 partners across the state and brief upwards of 5,000 individuals annually. Before I start, I want to take a moment and recognize and celebrate the decision that came down just a few hours ago, upholding the DACA program. And I know we are all here virtually, but I can imagine you all watching from your homes or your offices and silently cheering in solidarity along with us. We are so thrilled because this means that over 700,000 DACA grantees across the nation, including tens of thousands here in our home state of Georgia, can rest easy tonight. And while, of course, we have a lot of work to do to protect others who work, live, and play in our communities and in our country who wish to stay, today we celebrate all of our DACA friends and neighbors who are here to stay. In 2016, the Georgia Budget and Policy Institute embarked on an effort to begin to build a gender equity portfolio specifically tied to looking at ways to support and expand economic opportunity for Georgia women, as well as offer a gender lens to tax and budget policy. Because at the end of the day, as we all know, where our money comes from and how we spend it is a reflection of our priorities. Since that time, our organization has published multiple reports, activated women around the state on various issues from tax and budget policy to healthcare to building broader awareness around ways we can leverage policy to stymie the gender wealth and wage gaps, as well as proactively support gender equity. Last fall, GBPI released our latest agenda, Women-Powered Prosperity. And I'm going to share a few key points that give a sense of how we see the status of women in Georgia and what we can do about it. Georgia women make less money than men, leaving them more likely, as we all know, to live in poverty. Although the poverty rate is improving for both men and women, or was pre-COVID, about 14% of Georgia women 18 and older still live below the federal poverty line, compared to 10% of Georgia men. And when you further disaggregate that data, Black women and Latinas are much more likely to live below the poverty line. This means that policy solutions targeted to expand access to things like subsidized childcare, shoring up safety net programs, including Medicaid, and not just the very important extension of postpartum benefits, but also full Medicaid expansion, which would extend healthcare coverage overnight to roughly 155,000 Georgia women is critical. We also need to make sure that SNAP or food stamps are easily accessible and generous. And we must stop the long-time practice that the state of Georgia has in taking safety net dollars meant for direct cash assistance through the Temporary Assistance for Needy Families program and using it to backfill budget holes in other areas. Those would be excellent steps to begin to address some of the root causes of why women tend to face more higher levels of poverty than their male counterparts. There's also proactive things we can do with our tax code to better support working women who are earning low wages. Georgia is one of a handful of states that has not yet instituted a state-level Earned Income Tax Credit, or EITC, and there's bipartisan momentum right now to do this. And if we can get that done and make this important change to Georgia's tax code, we can extend additional cash refund support to nearly 770,000 women in Georgia. Next, we need to change policies to ensure women get paid equally and fairly in order to address the wage gap. And while there are a few ways to do this, I want to really emphasize one, and that is how critical it is to raise Georgia's very low minimum wage and how that would be such a huge step forward for Georgia women. Nearly 7 in 10 minimum wage workers in the state of Georgia are women. 7 in 10. Women represent 72% of the tipped workers who earn that sub-minimum wage of only $2.13 an hour. And finally, we've talked a lot about health, and I appreciate the leadership of Amber and Healthy Mothers, Healthy Babies. They are doing wonderful work to extend Medicaid benefits postpartum. But as I said before, the clearest step to helping women in Georgia access health insurance overnight is to expand Medicaid, which would basically open up health insurance, affordable as health insurance for 155,000 Georgia women. About 70% of women in our state have no health insurance. And that makes us the third highest uninsured rate for adult women of any state in the nation. Finally, I want to speak a little bit about what we're currently seeing as the recession begins to take hold. Some academics have rightfully called this a she-cession because women, especially women of color, have been disproportionately impacted by layoffs and downturns in sectors where women are frankly overrepresented. And that's things like home-based care, as well as healthcare industries, as well as hospitality and retail. We know the recession has prompted the state to call for deep budget cuts across the board. And Amber gave you some great examples of how that's going to disproportionately hurt maternal health and maternal mortality.
The cuts not only hurt those who receive state services, education, healthcare, and all of the programs that we rely on, but they also impact workers themselves, state workers who are facing furloughs and layoffs. And as it turns out, the majority of those workers are women, and in particular, women of color. There's a big push right now to get lawmakers to consider in this moment as they debate the budget, literally today, tomorrow, and moving into next week, to look at raising new revenue to avert some of the deep budget cuts that are on the table. And I welcome all of you to join GBPI and a wide network of partners that are working to have lawmakers look at bringing money into the state to make sure that we can protect education and protect healthcare and invest in the programs and services we know we need now, and we are certainly going to need as we begin to make our way through what seems to be a very difficult economy and recession. gbpi.org is the place to go, and I'm so grateful to the ACLU for including GBPI and being alongside Amber and Randy and Jewel and others as a part of today. Thank you so much.
Thank you, Jennifer, and everyone. To close out this discussion, we'd like everyone to share. Everything has been great with the information. We want to talk about what can be done now for women's rights and equality in Georgia. And I'll start off and then I'll kick it to the rest of the panelists. I'm just going to start off by saying with voting. With all these issues that we just said, we can take power and have our voice in voting. And I'll kick it to Jennifer, Amber, Randy, Subhashri, and Dabney to give your comments.
Great.
Jennifer first.
Repetition is key. Medicaid expansion. Women need to be healthy. We need to make sure that women can afford to see a doctor whenever they need to. I encourage everyone to go to coverga.org and engage there in the issue and send a note to the governor as well as members of the legislature calling for the state to expand Medicaid now.
Amber?
I would say supporting postpartum Medicaid extension, engaging your legislators, letting them know, even if House Bill 1114 passes, we need the funds to make sure that is covered for that period of time, as well as protecting the funds for maternal mortality reduction initiatives across the state.
Randy.
Hello, I want to plug the HEROES Act, which is actually a federal act, but you can still ask your federal congressperson and senator to support it. And so this would allow for cash payments, protections for essential workers, premium pay and family care for essential workers, including with child care, access to COVID-related testing, an extension of unemployment insurance benefits, as well as earned paid sick days and paid sick time off. So I would encourage people to definitely support the HEROES Act, and also just echo the other panelists about the budget here. They're making some very deep cuts to the budget here. So please talk to your local state representative, state senator about the cuts that are making to the budget right now, because they're cutting a lot from education and public health and community health. And obviously we don't need that. That's going to disproportionately affect women of color and Black women.
Okay. Quickly, Subhashri. We're having a problem hearing your audio, so we'll come back to you till we get that fixed, and let's go to Dabney.
Thanks so much. I think I'll circle back around to your original point, Jewel, and say voting, but not just in November, right? Because we have some runoff elections taking place in August 11th here in the state, and those are important. The other thing that I would call for in terms of a call to action is that we've had some really promising and positive decisions from the Supreme Court in the last couple of days, protecting LGBTQ rights as well as DACA recipient rights. We are expecting a decision in the June medical case, which is a reproductive rights abortion related case. And regardless of how the court finds in that case, if the court finds on the behalf of the state of Louisiana, I think that we can expect to see the introduction of some trap law legislation here in Georgia. And so we should be on the lookout and we should ready ourselves to fight against it. If the state finds in the case of June Medical on behalf of the plaintiffs, then I still think that we should expect Similar kinds of legislation as we've seen with HB 481, that battle continues in the courts, and the ACLU of Georgia has requested a permanent injunction, and hopefully we'll be able to hear news about that soon as well.
Okay, and let's go straight on to our final comment.
Thank you.
Sebastian.
I apologize for the technical difficulties, but I wanted to plug legislative transparency. All people in Georgia should be able to know what is being said in their state houses and be able to hold accountable their representatives for what they put forth and the ideas that they put forth. So write to your congresspeople, write to your state legislators, and demand legislative transparency.
Thank you all so much. Listen, that concludes our panel today. Thank you again for all the panelists, all your information. And now we will close out our discussion today with Andrea Young, who will share what is next.
Thank you all so much to all the speakers, and of course to Professor Oakley and Ifeanyi for your work in producing this report. This is exactly the kind of rich conversation we were hoping to have. At this time in our state and country, people are raising their voices. I feel like our children are fighting in the streets, literally fighting for their lives. And that the murders of Breonna Taylor, Rashard Brooks, and Ahmaud Arbery, and George Floyd have revealed the texture of systemic racism that's crushing people's lives, hopes, and dreams. We have to translate that passion, that energy, and that urgency into transformational policy change. And that kind of change happens when each of us commit to taking action. Each call we make, each door we knock, each protest we attend, each legislator we lobby, each voter we turn out gets us closer to the society we all need and deserve. So, as you heard from our panelists, urge lawmakers to take action now. Participate with us in developing a comprehensive women's rights agenda. And of course, turn out the vote. With the approaching election, we have a huge opportunity to elect more women and then push for the concrete policies that will advance women's rights and access. We're so close to having a firewall against abortion bans in the state house. And perhaps most notably, despite the election debacle we witnessed on June 9th, we still had a record turnout in the primary. We know women in Georgia are fired up to vote for candidates who will support us, our families, and our communities. We'll be contacting voters all across the state, and we hope you'll join us in doing so. Please also save the date for the Women's Candidate Forum on August 18th, which is also the anniversary of the 19th Amendment giving some women the right to vote. We cannot close this event without the signs of hope. The passionate, nonviolent protests that we see every day are a sign of hope. The historic Supreme Court decisions affirming that the Civil Rights Act of 1964 Title VII provisions apply to members of the LGBTQIA community. The Supreme Court's blocking the attempt to revoke DACA status from our dreamers. These are signs of hope. Thank you all again for your sponsorship and participation this afternoon. I look forward to the time when we can all be together. Until then, stay safe and stay well. Thank you.
Thank you so much for joining us this afternoon for How Far Yet to Go? The Status of Women in Georgia, 1970 and Today.